normally I would knock on the door and wait for the patient to tell me to enter. Once I've entered the room, I'm going to use sanitizer on my hands and then proceed. So hi, my name is Hillary Jordan. I'm a student nurse at the University of South Alabama, and I'm here today to do your abdominal assessment, if that's okay with you.
Yes.
Okay, so as you can see, she is laying down in a supine position. Her head is on a pillow, her knees are bent, and her hands are by her side. So I'm going to start off with inspection. So, do you need to empty your bladder by any chance?
No.
Okay, and have you had any tenderness on the abdomen?
No.
Okay, so her contour is flat. Her skin color is a little bit lighter than her arms and her legs, but that's normal. There are a couple moles. There are some striae. There are no hairs, however, and her umbilicus is midline and inverted. I see no hernias, and so I'm going to check for pulsations. You can see her aorta pulsating, but there's no peristalsis, and the abdomen doesn't appear to be distended. So I'm going to move on to auscultation. So I'm going to auscultate for normal bowel sounds using the diaphragm. I'm going to start in the right lower quadrant. Okay, so what I heard was normal bowel sounds. Normal bowel sounds are loud and high pitched. They're a cascading and gurgling sound that occurs 5 to 30 times in a minute. If she had hyperactive bowel sounds, it would be loud and high pitched. It would be a rushing and tingling sound, and it would occur more than a normal bowel sound does. However, if she was hypoactive, it would be quieter and more infrequent than the normal. If I was checking for absent bowel sounds, I would listen in the right lower quadrant for 5 minutes to be able to determine if there's any absent bowel sound. So the next thing I'm going to do is listen to the arteries. I'm going to change this over to the bell. I'm going to start off with the aorta. Okay, can you bend your elbows for me, please? Okay, I'm going to go inwards for her elbows. We do the same on the other side. And what I'm checking for now is her renal arteries. Okay, next we're going to move on to her iliac. Okay, and I did not know any breweries when I was listening. So the next thing I'm going to move on to is percussion. Oops. Okay, so what I heard was tympani, which is what you want to hear. I did hear a little bit of dullness, but that can be due to stool. I would also make sure I percuss the kidneys, but I am going to do that at the end because I'm going to get her to sit up. So next we're going to start off with palpation. So I'm going to do light, which is about 1 centimeter. What I'm checking for is good muscle tone and surface character. Okay, so she does seem to have good muscle tone and surface character. So the next thing I'm going to do is going to be deep palpation. So that's about 5 to 8 centimeters, and I'm checking for any masses or tenderness. Did you have any tenderness?
No.
Okay, so there's no tenderness noted, and I didn't see or feel any masses. So the next thing I'm going to do is palpate for the borders of the liver. So I'm going to put my hand underneath your ribs. I'm going to ask you to inhale and exhale deeply. Okay, can you do it one more time for me? Okay, so her liver was non-palpable, which is what you want. I'm going to also go ahead and check her spleen. So I'm going to cradle her ribs once again on the opposite side. And put my right hand towards the silica. Okay, go ahead. Or the silicae, I'm sorry. Okay, one more time. Okay, and I could not palpate the spleen, which is also normal. So if you would stand up or sit up for me, please. Okay, I'm gonna move around the counter. Dangle your legs. So what I'm checking for now is CVA tenderness. So you go to about the 12th rib. Okay, let me know if you feel any tenderness, okay? No? What about now? No? Okay. And so that concludes my abdominal assessment for today. Thank you.